I like CaringBridge for a number of reasons. With the families, it's a chance for them to get out of the room, gives them a break from the stress in the ICU environment. For some parents, it's kind of a release of stress. Writing can be like a therapy for them. It's a way for them, if they can't do cares at the bedside in intensive care, a lot of times they can't, then that's something that they can do for their child, updating the family. And it's only one update versus making 50 phone calls or whatever they might have to do to keep a family or friends updated.
I think it alleviates some of the family's tension and stress because they can pull their family in so quickly if they need help, and that makes it easier for us because we're so busy taking care of the baby that we can't always be the emotional support for the families. We can do a lot of it, but families, friends, and their siblings and their other relatives really are the big support, emotional support for them.
I think it's great for families to be able to express what they're feeling. I think we as the caregivers at the bedside, we're very into the technical aspect of it. It's important for families to be able to tell their story in their healing process. Even if their child is doing okay, it's still a process for them to get through an NICU visit and to be into the hospital for so many months sometimes, so many days maybe for some families, but months for many others. And I think it's a good way for them to heal that part of their life by being able to journal it.
I think it's a great tool because it kind of helps relieve some of the stress that families can feel when their kids come into the hospital. And just having sometimes that release for a mom or dad to step out, write an update on the computer and send it out, and then everybody else can pick it up from there, I think it was a tremendous relief for them. And it kind of helped my position, nursing-wise, because then we weren't dealing with a very stressful parent who was constantly receiving phone calls.
I think it's a helpful tool for our families because it gives them the ability to have some power over a situation. I think in many of our patients, the diagnosis is devastating to the family, and so people are interested, want to help, but because people are so interested and want to help, that can be overwhelming to families. And this is a good way to get some real basic information out to lots of people, and that the family doesn't have to keep repeating their story over and over again. So I think that's very valuable to our families.
You can put in the website what you want, and you relay what information you want and the way you want to do it. It's always nice. The phone interruptions are big. I've heard a lot of nurses, they don't like to take phone messages. Some feel like if the phone rings, they need to answer the phone. So there's a lot less interruptions for us at the bedside.
I take care of a whole family, and so I'm looking at the parents, and if the parents are stressed out or that they are able to kind of take control of a situation, spread information the way they want to spread it. I think that that's valuable, and also just be able to focus on their child instead of having to focus on everybody else who really is well-meaning and wants to help this family, but can be very time-consuming to them. I think that families use it all different sorts of ways. I mean, some use it because that's a way of communicating that they really like. Some use it more on a basic level, and that's what I would encourage people is to use it in the way that works best for them and really serves their needs.
Years ago, when CaringBridge wasn't existing, families would set up special phone lines and things like that to try to get information out, and it's just made life so much easier. For many, it's like they're obsessed with it. They love reading it, they love hearing the emails back, and I think it's just a great way to be able to communicate with your loved one that's ill.